All right, welcome everyone. Thank you for joining tonight. I'm just going to give another minute or two for people to enter the event and we will get started. All right, Dr. Ubaque, I think you are good to take it away.
Hello, everyone. Welcome to our Hispanic Heritage Month presentation. Today, we'll be speaking about the myths and truths of COVID-19 vaccinations and how it's affecting our Hispanic communities. My name is Anibal Ubaque. I'm your moderator for today. I'm a doctor of pharmacy and National Hispanic Pharmacist Association Education Subcommittee Chair and Pharmacy Clinical Services Manager for Walmart based out of Denver, Colorado. With us today, we have Stephanie Velez, Doctor of Pharmacy, Staff Pharmacist at Walmart Pharmacy based out of Omaha, Nebraska. But first, before I officially present Stephanie Velez, we go to the next slide, a little bit of housekeeping rules. Your microphones will be muted. Please type any questions into the chat box. An open panel discussion will be followed by a 10 to 15-minute audience Q&A session. And the recording and slides will be sent out and posted on our website next week. So go ahead and check us out on our website. There'll be great information on there along with this presentation. So with that, I will go ahead and go over our mission and vision, who we are, the National Hispanic Pharmacist Association. Our mission, to empower Hispanic pharmacists and other members to improve the health of Hispanic populations in collaboration with public and private sector partners. Our vision, to be the lead pharmacy organization for improving the health of Hispanic populations in the United States. With that, I'd like to officially introduce Stephanie Velez, our guest speaker for our presentation today. Stephanie?
Good evening, everyone. Thank you for joining me today. I am Stephanie Velez. I am a staff pharmacist at Walmart Pharmacy. I am a vegan chef and a personal trainer as well. I care about health and lifestyle modifications. As a staff pharmacist, what I focus on is I verify that the prescription that comes in from the doctor, make sure that it's safe. It doesn't interact with any previous medication that the patient has. I make sure that the correct strength and medication goes out once it is filled. I suggest cheaper alternatives just to make it easier for you or in my patient. I counsel or I advise on over-the-counter treatments for minor allergies such as allergies, rash, cold, and so on. I am a vaccine expert. I do diabetic and cholesterol checks and blood pressure as well. My main focus today is to get any doubts and ease any doubts on the vaccines and any questions on the COVID-19, address any questions on the COVID-19 itself. I hope this presentation helps in covering those doubts. It was very educational for me and I hope it is for you. So today for the presentation, I will go over how COVID-19 virus is spread. We will define the herd immunity and how it falls into the category of the COVID-19 vaccine and COVID-19 itself. Some of the side effects of the COVID vaccine and what to expect. We will reiterate vaccines are safe and they are free. And we will talk about some disinformation on the COVID-19 and the COVID-19 vaccine and where to find information to get a vaccine the vaccine for the COVID-19 nearest your location. Next slide, please. So the COVID-19 spreads through droplets via when one coughs or sneezes. So the person who has the virus sneezes and coughs, and those droplets either fall on an object or on a person. And so the person can either touch the object and with that dirty hand can touch eyes, mouth, and nose. And that's how the virus lives in the body and multiplies. So this is why we ask that you cover your mouth with a face mask, wash your hands for 20 seconds, and make sure that you practice social distancing. And please make sure to keep me slow down because I am excited about the topic and I do talk fast. So we gotta make sure that we protect others by wearing our masks and maintain social distancing because the virus likes to attack more in winter and not, quote from Game of Thrones, winter is coming and we gotta protect those who can't get immunized yet, like children, those who are immunocompromised or do not have a strong immune system. So we gotta do our parts by putting our masks and wash our hands. Next slide, please. And just now that we're talking about how to wear our mask is make sure to put it over the nose and over the mouth, because again, that's where the droplets come from when we sneeze or we cough. And that's how we protect others. Next slide, please. Herd immunity. The definition of herd immunity is when a large population is immune to the disease, whether it be from getting the vaccine or getting the disease. The virus doesn't have, so the virus can go to person in order to live and to change or mutate, get stronger. That's how we got Delta virus. The herd immunity, like I said, it can be achieved from the vaccine or from the disease. We do not recommend having the disease because we don't know the outcomes, especially if the person has other chronic conditions like diabetes or obesity. It can be fatal for them, or it can send them to the hospital where there's limited or lack of resources. The resources are being stretched very thin. So again, the vaccine that protects the people from getting to the hospital, and it's usually just a reaction for a day or so. Next slide, please. Now that we're talking about the Delta variant, this is a mutation or a change from the COVID-19, and it spreads more easily than the previous variant of the COVID-19. It may cause more than 2 times as many infections. However, vaccines in the United States are still highly effective, have shown to be effective, including against the Delta variant. And it protects you from getting hospitalized, severe infection, and death. Next slide, please. After the Delta virus became the most common variant, surveillance shows that fully vaccinated people have reduced risk of infection by 5 times, or hospitalization by greater than 10 times, and death by greater than 10 times. Again, vaccination offers strong protection against the COVID-19. Next slide, please. And this slide just shows how the comparison of fully vaccinated people, shown in the yellow, versus those who are unvaccinated in the blue. Those who are unvaccinated are 29 times more likely to go to the hospital, where again, the resources are very thin, are stretched out very thin, there are limited resources. So vaccines get you out of the hospital and you might have a very, the disease, but not as severe. Next slide, please. So facts about the COVID-19 vaccines. The vaccines are a scientific wonder. We have 3 of them. The mRNA method, the mRNA vaccine methods have been known for 30 years or so, but they came now to save lives, basically. They take a part of the gene from the virus and into the vaccine, and it gets inserted in us. Our bodies, when we get the vaccine, it triggers the immune system to protect us. It gets worked up and fights back by making antigens, and it destroys the mRNA or the gene. So this is after getting the 2 doses. The body remembers how to protect us once we get the virus again. And when the antibodies that were saved from the 2 doses come back to protect us, and so we don't get the severe disease or we don't go back to the hospital. So it's after 2 doses from the Pfizer and Moderna and 1 dose from the Janssen or made by Johnson & Johnson. So again, These vaccines do not affect or interact with the DNA in any way because it does get killed. It doesn't even have a chance. I mean, there's no way that it interacts with our genes, and do not give anyone COVID-19 because it is not the live virus itself. Next slide, please. So we do have 3 equally effective vaccines here in the United States. We have Pfizer and Moderna, that are made from the mRNA vaccine. The Pfizer are 2 doses approved for 12 years and older, 2 shots given 3 weeks apart. The Moderna is approved for 18 years and older, 2 shots given about 4 weeks or 28 days apart. And then we have the Janssen, which is 1 shot, also approved for 18 years and older. Do not wait to get any vaccines. They're all 3 are equally effective. The Moderna and Pfizer have shown to be about greater than 90% effective to get you out of the hospital or having a severe infection. And the Johnson is about greater than 80%. Next slide, please. So my patients come and they ask me about some side effects or what to expect after the vaccines. So from the first dose, you are going to have a sore arm, most likely pain, redness, and swelling. The second dose, remember, the vaccine is acting on your immune system. So on your second dose, you might have some tiredness. I've had people complain of headache, muscle pain, joint pain, chills, fever, nausea, and or diarrhea. Next slide, please. So what I recommend to my patients and what I would recommend to you is make sure for the second dose, try to get the day off. If you have the weekend, try to rest. To reduce the pain and discomfort, apply a clean, cool, wet washcloth over the area, exercise your arm, try to do some weightlifting, just exercise it. For the second dose, I would do Pedialyte if you can, or Suero, and I know some Latinos like Suero, or they relate to that. Drink plenty of fluids to prevent nausea and or diarrhea, and dress lightly. If you can, alternate Tylenol and ibuprofen every 4 or 6 hours, depending on how you feel, fever and pain. Next slide, please. So even if you have had the COVID-19 disease, study shows that the COVID-19 vaccine is recommended because it adds more protection to your immune system. It prevents you going to the hospital again where there's limited resources. It keeps you from spreading the COVID-19 and protects you again from serious illnesses if you get sick again. It makes your immune system stronger. Next slide, please. So this slide just shows, just reiterates what I said before. COVID-19 vaccination reduces the risk of getting COVID-19 and helps protect you from severe illness and death. Right now, most cases of COVID-19 are in people who are not fully vaccinated, and some people who are fully vaccinated will still get COVID-19, but the illness is usually much less severe. Next slide, please. So COVID vaccines are free. Immigration status is not an issue. And if you have insurance, it's also not an issue. COVID vaccine is free. Vaccination centers are prohibited from verifying immigration status. I usually ask my patients about some type of ID or some type of identification, whether it be a passport, because we have to write down your name, the correct name on a card for you to take to work or to travel. So we want to make sure that we're spelling it correctly with the right date of birth. Next slide, please. All 3 COVID vaccines are safe and effective. What does it mean effective? It protects you from getting the severe disease. The FDA and the CDC have high standards on these vaccines. Even after being approved over a year or so, they're still being monitored. And one of the ways that they monitor is, next slide, please, is by having people report any side effects to the FDA and CDC to this VAERS, or the Vaccine Adverse Event Reporting System. And we provided this slide for you to take a picture and send it to your friends and or family who have other side effects that have not been reported on these slides. There's a website you can go to report it. And there's also an app called VSafe that uses text messages just to check how you are, any side effects, any weird interactions or side effects that you had not seen by other patients or other people. Next slide, please. I know there's a lot of information on the vaccine itself and COVID-19 on social media, but before you read it and pass it on, ask yourself, who are the sources? Are they actual doctors? Are they trustworthy? Are they backed up by scientific evidence? Most of our information today is backed up by the CDC. So, just again, ask yourself, are they trustworthy? Are these resources trustworthy? Can you find that information somewhere else by a reputable source? Next slide, please. This slide just shows where you can find the nearest COVID-19 center. You can take a picture also. You can go to the vaccine.gov for English or vacunas.gov for Spanish to find the vaccine nearby. You can text these numbers also to get the nearest 3 vaccine site centers, and or call this 1-800 number and to verbally guide you for the nearest vaccination center. Next slide, please. So before I open it up for questions, I just wanted to share that I got the vaccine when it first came out, I believe in January, just because since I work I'm a healthcare worker and I am around a lot of people, I was afraid to send my kids who are 2 and 6 to the hospital. I didn't want to be the reason that they went to the hospital or got, God forbid, fatally ill. Or my parents who are over 70 years old. So that's why I got the COVID vaccine. And, I still work with healthcare providers, and I feel like I haven't been able, or I am pretty immune, and I haven't been able to pass it on, or not that I want to, but, it's kept me pretty safe. So I addressed 3 questions that I got today. So one of them is, what is the time frame of the efficacy of the COVID-19 vaccine? So according to the CDC, people are considered fully vaccinated 2 weeks after their second dose in a 2-dose series like the Pfizer and Moderna, or 2 weeks after a single shot vaccine like the Janssen made from Johnson & Johnson. Next slide, please. The second question I got, what is the main reason Latinos do not get vaccinated? So again, it's rumors from social media, instilling afraid or doubts on the vaccine, concerns about immigration status and the cost of the vaccine. Again, the vaccine is free, and immigration status, the vaccine centers are forbidden to ask about immigration status before giving the vaccine. Next slide, please. And lastly, I got getting a COVID booster vaccine even after having received 2 Pfizer shots. Per CDC, the protection against the virus may decrease over time and be less able to protect against the Delta variant. Remember, the Delta variant is very contagious. So this is especially true among healthcare workers and other frontline workers who are around people. And it's likely, again, greater infectiousness of the Delta variant, and likely due to the waning immunity of a person. Next slide, please. So Pfizer has demonstrated that the booster shot increased immune response in trial participants who finished their primary series 6 months earlier. So it's an increased immune response. People should have improved protection against the COVID-19, including the Delta variant. So this is my presentation today. Again, I want to thank you all for joining me tonight. Thank you for the National Hispanic Pharmacist Association for hosting me, and I will answer any questions you guys might have.
Stephanie, amazing presentation, very informative. Lots of graphs and facts that help us address many of the questions and hesitancies to help us, protect ourselves against this horrible virus. So I went ahead and we're going to field some questions we received before the presentation today. Let's go with the first one. Should be taking a COVID booster vaccine shot if already taken 2 Pfizer shots? It's kind of ever-changing question, but asking, should we be taking a COVID booster shot if already taken 2 Pfizer shots?
Yes. Like I just mentioned on the last slide, our immune system does wane or go down over time. So just like the flu shot, it's recommended now to do a booster shot, especially if you're immunocompromised or you're a frontline healthcare worker. It just improves your again. It's making your immune system work or stronger to protect you from a severe disease.
And I think this question also, the second question, kind of piggybacks on that. Is what is the time frame of the efficacy of the COVID-19 vaccine?
Yeah, so it's 2 weeks after your second dose for Moderna and Pfizer, and 2 weeks after your first dose for Johnson & Johnson.
Perfect. And then another question, will the COVID-19 vaccine harm or enlarge my reproductive organs?
No, it will not. Remember, the vaccine only is triggering your immune system and it gets destroyed. The virus gets destroyed after that.
All right, and let's see what we have in our chat box right now. Can the booster shot be mixed? Example, Moderna with Pfizer booster.
Right now, it's not recommended. So if you had Pfizer for the 2 doses, they recommend getting the Pfizer 6 months after your second dose. And then for Moderna, they're still talking about getting the booster shot out pretty soon. So stay tuned.
Awesome. Yeah, great question. Any other questions in our Q&A? Another one I received also earlier was, can the COVID vaccines be co-administered, or is there a time frame with other vaccines? For example, we're in the middle of flu season. So can we co-administer that flu shot with a COVID vaccine?
Yes, you can, actually. You can get all of them.
Yeah, and I believe there's some really good information on the CDC as well that has literature that kind of shows you proof that there is efficacy and safety behind that as well. Mm-hmm. And then also, if you are, let's say you are willing to get the COVID vaccine, how would you suggest going around maybe, given these facts or kind of urging your family members or friends to get vaccinated? What resources would you use and what recommendations?
Local pharmacies, your pharmacies are very well knowledgeable on these vaccines. I provided some slides also where you can call the 1-800 and they can also give you some advice. The CDC is a wonderful resource. They are always updating the information, and you can call them, or you can go on the website and actually go online and they have a lot of facts, questions and answers on there for our patients.
Awesome. Yes, there are plenty of resources, and make sure we use reliable resources as well. Our CDC, our FDA, and our pharmacists and our other healthcare providers. You have a primary, your pharmacy. I know a lot of community pharmacies, it's advice. You don't have to make an appointment. You just walk in and ask them those questions. Thank you for that answer, Stephanie. And then I have a question from Mario. I had lunch with a person who had the coronavirus. She had the first shot, I'm guessing the coronavirus vaccine. She had the first shot and got a terrible headache and doesn't want the second shot due to headaches she had. How can I convince her to get her second shot?
Yeah, so usually that is pretty hard, but the headache may be from other sources. It's still acting on your immune system. Everybody reacts different. To convince her, it just it makes the immune system stronger, reinforce how she's protecting her community, her family. The second dose, she can take some Tylenol if she can. It's just going to be one day that it's going to be the side effect that she might get the headache or she might not. A lot of people on the second dose didn't complain on anything. You know, like my coworkers, some of them were fine. You know, I was dying the next day, but you know, a lot of people have side effects differently. But it all ends on let's prevent to a severe disease. We don't know if it's gonna end up in a fatal illness, the disease is, or you know, we don't want to spread it. We want to help out our community by protecting ourselves and blocking that virus from coming into our bodies and becoming the Delta virus or the next variant. Who knows?
Yeah, thank you, Dr. Velez. Yeah, and I think just to summarize what your answer was, basically the benefits outweigh the risk, right? So the benefits outweigh a headache or a migraine, and then you can treat those side effects. You can treat that headache. You can treat that site reaction if you have some pain. But right now there's no treatment that's very effective against the actual COVID virus. So that's why I think, again, the benefits outweigh the risk. Thank you so much, Stephanie. I think we have another question by Catherine Thomas. You stated the reasons why Latinos might not take the vaccine. Do you have any recommendation on how they can be encouraged or motivated to take the vaccine?
Yeah, I mean, this is hard. I have a lot of patients who have their doubts, and that's why we're doing this presentation to answer any doubts. But you know, we say that if you have a chronic condition, this prevents from you going to the hospital, protects you from passing it on to your family, especially if they're older. It makes you a better quality of life, because if you have the disease, sometimes it has some side effects or some sequela, some side effects. Like I know my father-in-law has potential lung that like has problem in his lungs left from the disease itself. So you don't know what happens after the disease, even months after getting the disease. So with the vaccine, it's known, okay, yeah, the next day you might not feel well, but at least you're not going to get the severe disease and the long-term side effect of whatever that might be.
Yeah, great answer. And then again, the three main points I heard from your response was, the hospitalization rates are much lower if you are vaccinated, right? A lot of the hospitalizations we're seeing, I think you covered it in the slides as well. The percentage of unvaccinated rates in the hospitals is much, much higher, significantly much higher. So that's one great way to motivate and encourage. Second is that you're protecting not just yourself, because maybe the individual thinks, hey, I'm healthy, I'm young, or I'm strong, but you also want to make sure that they acknowledge that they're not just putting themselves at risk, but they're putting their loved ones at risk, right? So if they care about their family, and I would say everyone cares, about someone, a family or a friend or a loved one, if they care for them, they'll protect them. And I think that's a great motivator as well. And then again, to finally, what your final response was, the long-term effects, right? We have a lot of these cases where they call long haulers, where it's taking months and months to recover from severe illness. And then, so you want to maybe explain those things that, it take time. And then another thing I'll throw in there is that you can get COVID twice, right? If you're not vaccinated, there's people that have gotten the infection, and then it comes around in less than a year, they get the infection for a second time. So I think those are ways to encourage. Thank you, Stephanie, Dr. Velez, for answering that. Let me take a look and see if I have any more questions here in our chat box. I think we have a Q&A as well. We have a question from Nepta. What can NHPA do to get COVID information in Spanish?
We actually have another presentation tomorrow, if you'd like to join, and it's in Spanish. So yeah, join us tomorrow, and the slides are translated. Everything I said, they're all translated in Spanish. So you can also hear the recording and show it to your friends and family for tomorrow's presentation. Yeah,
definitely. Please reach out to us if you need the information to register for that webinar tomorrow. It'll be completely in Spanish. The slides will be in Spanish. Everything will be in Spanish. So I highly encourage your Spanish patients or your loved ones, to join that webinar, and it'll be very informative, and we'll answer the same questions or similar questions they may have, or, if they have questions, we'll be able to answer them live. All right. And then let's see, we have, I have an anonymous attendee. What efforts are being made to reach populations like a Hispanic community with lower uptake of the vaccines? Great question.
So far, in my vaccination center at Walmart, we've been trying to promote it, with wellness events. I've been actually trying to promote it via my community on YouTube, getting the education. So check your nearby stores to see also like the resources. I know NHPA has some information online to reach Hispanics. That's what I have so far.
Yeah, definitely. And then NHPA's, mission is to empower Hispanic pharmacists and other healthcare providers to collaborate with the public and private sector, right? So we definitely, whether you're a Hispanic individual not involved in healthcare, you can definitely reach out to, whether your community pharmacy or your healthcare providers. They're usually involved in Hispanic, or you can reach out to NHPA. We would definitely love to build bonds with the community, whether you're involved in the church or, any kind of group that, we would love to make more outreach. And I think a lot of healthcare providers try to provide that knowledge through these kind of webinars, going out in the community, and building those partnerships with the private and public sector to build a network so that we can provide this information and improve the overall health of our Hispanic patients. But yeah, amazing questions. Let's see. Let me see if there's anything here. And then Vito went ahead and sent the link out on our chat, and that's the registration link for tomorrow's webinar that will be completely in Spanish. See, any more questions? Okay. Mike asked, what is the biggest fear you run into with the Hispanic population in getting the vaccine?
There's really not a lot of fear. They do have a little bit of concern on their side effects. But I know that I've had some patients, well, I didn't return for my second dose because I heard on Facebook or somebody said that she wasn't feeling on the second dose. And that's mostly their fears. But, like I mentioned in the slide, you can either alternate with Tylenol and or ibuprofen. I know some people can't take it off work, but try to take it easy. Drink a lot of fluids and or Pedialyte or Suero. That's mostly the fear that I have at work.
Yeah, I think the fear is that our Hispanic population does not receive the vaccine, rather the fear that they get the vaccine, right? Or the fear is our Hispanic population, because we live in such close social groups sometimes, it could run rampant in our communities, in our Hispanic communities, just so we're so, Hispanic, Latin background, very loving, we like to hug. So, we're very tight-knit communities. So my fear is that it will spread through our communities, disproportionate with the negative proportion, compared to the rest population. And then another thing is maybe misinformation. I think Dr. Velez, what you alluded to, is, make sure that our Hispanic population are getting reliable sources, not going just off Facebook, a link that you see on Facebook or other kinds of social media, that they're getting reliable sources that is in our native language, right, as well. So misinformation, I think, is one of the fears of our population not getting the vaccine. Let's see, another question. Okay, it's just some subjects. If you have some questions, it's on population, the younger generation vaccinated, diversity in clinical trials, mental health. Let's see. Eloisa has a question here. What would you recommend for a patient that missed a second dose for more than 3 months? Restart the series or give the shot and then recommend the booster?
That's a good question. Do you know which vaccine right now, or which, was it Pfizer, Moderna? Well, either way, right now, the CDC is okay with saying, you know, you have a 28 to 42 day window to get the second dose, but then also if you don't have to restart the dose, even if you miss the second dose. And even if it's Pfizer, I would recommend to get the booster shot, but with the Moderna, stay tuned because I think the CDC is meeting next week. So, and then also for the Johnson, I think the booster's coming out, or the CDC is coming out with a booster. So stay tuned, but I do recommend getting that second dose as soon as possible and getting the booster when available.
Yeah, definitely. And it's an ever-changing thing, right? And it does definitely depend versus if it's Moderna or Pfizer. For now, right now, Moderna is not approved as a booster. This may change in the near. You may hear it in the media first, and then the FDA will say something, and then it has to be actually approved by another organization, the ACIP. So it might take a little bit before the media. So just, you know, make sure that you stay informed. Again, ask your healthcare professional, your pharmacist, your primary physicians, your healthcare providers. They'll have the most up-to-date information from the organization that they get their guidelines from. In regards to, again, to the Pfizer as well, no matter if it goes 3 months, you still want to get that second dose. You do not want to restart the series. And then for Pfizer right now, the recommendations are, you know, if you're allowable for a third dose if you're immunocompromised because the first two did not work. But if you need a booster, the booster, you have to meet the guidelines right now. And again, the guidelines are right now, if you're in certain occupational, in certain occupations that make you high risk, or if you're above 65 years old, or you have underlying conditions. So yeah, a lot of things into this question. It was a very, very good question. And hopefully that was answered. If you need more clarification, please type it in the chat. Let's see what else we have here. I think this question's on diversity in clinical trials. So probably, I'm trying to decipher the question here, but I believe, is there diversity in their clinical trials that on the efficacy and safety of the vaccines?
Sorry, could you repeat that?
Yes. So they want to know if the clinical trials, like stated on the CDC and all the clinical trials on efficacy and safety, does it offer a diverse population in the studies?
Yes, I mean, so the slide that I showed previously, so the vaccine has been out for over a year and everything has been reported to that website. So when we get the vaccine, the 2 doses, the side effects, there's the Be Safe. They text you about any side effects or anything, and it gets monitored. So patients get asked, and then they can answer those questions to those websites, and it's very diverse. And especially when you come to the pharmacy, you fill out a sheet, and we also submit that to we report that. And you know, it's a surveillance in every diversity, like pregnant people, and you have to report your ethnicity. So right now there's a lot of studies or a lot of surveillance on a diversity people now that the vaccine is out more than a year now.
Yeah, so I purposely in the studies, they want to make sure they get a diverse population for sure. So it's definitely been studied in Hispanics and all the other ethnicities and population. And again, like Dr. Velez alluded to, there's live surveillance, right? The Be Safe, the side effects are all being notated, and that's the data they're going off of as well. Okay, another great question. Do we have data on how many Latinos have been vaccinated nationwide? Nationwide to California. And then I think he's representing the Chicano Latinx Alumni Association. Great question.
I do not have that data. I don't know if.
Yeah, that's a great question. I mean, we can definitely get back to you on the updated statistics on that, on what, how many Latinos have been vaccinated nationwide. I know there's definitely an opportunity that Hispanics are maybe not as, the vaccination rates are not as high as the majority of the population. So to give you exact numbers, we'll definitely have to get back to you. So I'm go ahead and notate your name, and then we can send you a message with the exact statistics on that, because I think it's ever changing. It changes on a weekly to monthly basis. So something we might have had on the presentation a week or two ago has probably changed. But great question, and thank you for being so. Yes. Oh, there we go. I think we have a link. Let me click on this. Okay, so federal data as of October 4th. So this is pretty recent, October 4th. CDC reported 2/3 were white, so 60% were white, 11% were Black, 17% were Hispanic, 6% were Asian, and 1% were American Indian or Alaska Native. So, a majority of the population, that's been vaccinated is 60%. And then let me see if it tells you. So the share of recent vaccination going to Hispanic people is 15%, which represents a decline from earlier periods during which the recent vaccination going to Hispanic people was larger share of the total population. So there's actually been a decline in, as the other groups are getting more vaccinated. Great question. Thank you so much, Dr. Beatriz, for sending us that up-to-date data. And any other questions we have here in the chat? You keep them coming. They're great questions. Like, you guys are keeping us on our toes. I love it. Okay, it seems like that may be it for the questions. If you can please put up the last slide, ways to connect with us. You can definitely, if you happen to have any questions, 30 minutes from now, an hour from now, tomorrow, a week from now, a month from now, please connect with us via our website. We're also on Facebook, Instagram, Twitter. About to get our screen up with our information. We have also our website, and you can even call us and check out our website. Yes, please connect with us. We're here to answer any questions that you may have as a student, as a patient, as an individual that wants to help out your Hispanic community, as a healthcare provider. And if you have a question for you or your family, we're here to answer those questions and to provide guidance to help the overall health outcomes of our Hispanic population. So with that, I'd like to thank everyone for joining us today. We had some wonderful questions. I want to thank Dr. Stephanie Velez on her great presentation. Very informative, and hopefully it helped to guide us, some of our attendees in the right direction. And other thank yous are coming through the chat. So thank you so much, Dr. Stephanie Velez. Thank you for the National Hispanic Pharmacists Association putting this together. Very informative. We really care for our population. And with that, I wish everyone a great day, and reach out to us if you have any more questions.
Thank you everyone for joining.